Greetings everyone. Welcome to our Prep Hour with Steve session. This is the sixth session that we've done so far, and today's focus is going to be writing a respite admission. Now I'd like to know where everyone is, and today's focus is I'd like to know where you're all located. So just type in where you are and what time it is so that I can actually see what's going on, where everyone is. So I'm here in Brisbane on the east coast of Australia, and it is just gone 4:30 p.m. So just type in where you are. Hello to Marwa over there in the UK. Very good morning to you. Type in what time it is as well, so we know what time it is. Rosa, hello to Rosa there in Italy. We have Novi, 4:30 in the afternoon in the Philippines. Good afternoon. Hello to Sibi here in Brisbane. Glad you could join us locally. Hello to Munza over there in South Africa, where it's 8:30 in the morning. We have Aswadi in India at 12 p.m. Hello to Thikra, hello to Russell there in the Philippines. So great to see you all here for the live session. I hope you can see and hear me clearly. Now today's focus, as I said before, it's going to be a writing focus. And we're going to look at a particular task. We're going to do writing a respite admission. All right, so let's get started. So you can see in this image, I'm going to paint a bit of a scene for you all, everybody. We can see a community nurse here, and they're actually doing a home visit. So that's our setting. So the card we're going to look at, it's all about a nurse who's been providing community care for a patient at home, and this patient is going to actually be admitted. That's the task, to admit the patient or to request respite admission. That's actually what's going on. So that's our scenario. Now, Khaled says we can even hear a puppy. That's right. There's a puppy outside beaming all the way from Brisbane, Australia. So we're out in the community here, delivering online. So you get the authentic Australian experience. All right. So yes, here's our community nurse. Let's find out what this nurse has to do and what's been going on with the patient. So we've got our case notes, and we're going to write a full letter today. We're going to write a full letter. So we're going to start with our introduction. We're going to look at our case notes and look at our writing task. And what I want, but when I say we, I'm going to help with the letter, but I actually want you guys to write it. And I'll be the editor to help us bring it up to a nice standard. Okay, so let's go through our case notes first. So we've got a date, and that's today's date, everyone, 6th of March, 2019. So let's read our task. So it says you are a community nurse working for Blue Care. And that is actually a real organisation in Australia which provides community care to patients in need. And it says here, you've been providing support for Crystal Ball. It's a nice name, isn't it? You've been providing support for Crystal Ball and her family for the past 2 months. So straight away, you know this is a known patient, someone you've been looking after for 2 months. Now, before we go into any detail, it's always a good idea to read your writing task to know exactly what's required. So here, it's just a short version. It says, write a letter to the director, Redeemer Palliative Care Hospital, 32 Nelson Drive, St. Lucia, Queensland, with a postcode. And then it says requesting palliative respite admission. So that's very useful information. That gives us a focus. Once you read that, you know exactly what you need to do and why you're writing. And you need to make sure that that focus is very clear in your letter. So when you get that sort of information, it's a good idea to underline, especially once they allow you to pick up your pen after 5 minutes time, you'll be able to underline that key phrase. Now let's read our case notes and find out a little bit more. So we've got the patient's name, we've got a date of birth. So the 14th of February 1976, married with 2 children aged 10 and 12. We've got a next of kin, that's her husband Mike Ball. We know his job, he's a real estate agent. And Crystal Ball herself, school librarian before illness, so not now. And we've got an admission date, so admitted 18th 12/18 with severe stomach pain, laparoscopy performed, and stage 4 ovarian cancer diagnosed on this date, right? But remember, we're here in March, so we're a couple of months after that. We continue on. The cancer has metastasis. Laparoscopy was performed. Yep, we got the diagnosis. Cancer metastasized to liver and left lung. And then it's a negative prognosis with a life expectancy of 4 months. Increased pain, depressed, not eating well. Chemotherapy was offered to shrink tumours and slow growth. Mrs. Ball refused, wished to return home. And then she was discharged home on this date. So this connects to what's said at the top here, everyone. Make sure you can link these facts when you're reading your case notes, because it takes a little while to work out exactly what's happening. So since that date, since the 2nd of January, you've been providing care for this patient. But now this patient is going to be moved to you're going to request a palliative respite admission. So there you go. And if you're going to request that, then you're going to need to provide a bit of background information about the patient's history of illness. And you're also going to need to provide information about the patient's current health. All right, so let's begin. Now here's a little exam strategy that I'm going to advise you to do. I'll just set up my writing. I think it's a good idea when you begin your letter to actually put, personally, there's a few places you can put the date. I personally like to put it up the top, but there are other places you could put it below the address, but let's just put it there. I think as a good exam strategy, the very first thing you do is just write the director, and then put this information, good exam strategy, just get this information down immediately. Right, Redeemer, just spell that right. Redeemer, palliative care hospital. And then we put the address, 32 Nelson Drive. You can use short form there. If we wish, St. Lucia. And then we might put below that our state, if we wish, and a postcode, right? 4050. And then we put the subject line, and we'll put the patient name, Crystal Ball. All pretty basic stuff, but you need to do it. And you can just put a little space, and you can put date of birth, and we simply put 14/02/76. Now, that's part of the letter, everyone. You do get marks for having the correct presentation. So do take the time to get those things right. Make sure that you spell things correctly. If you make spelling errors here, or if you have punctuation errors here, well, you will lose marks for those sorts of things. So even little things like if you had a lowercase hospital, you know, that's not correct punctuation. That does need to be a capital. If you're in a hurry and you spelled the patient's name wrong, well, that's not good either. So attention to detail to make sure you get these things right in the beginning is important. So that's sort of the basics. So set that up. And then on exam day, I would ask you, after you've done this, to go back to your letter and begin the writing. So we'll do one more thing. So we've got now, I've changed my order a little bit here. I forgot to do this, everyone. Dear Director, that's better, because we're writing to a director. You could put Dear Sir, Madam as well. That would be perfectly acceptable. So now we're ready to go. We can actually write our introduction, everyone. That's all we're going to do on this page. We're just going to write an introduction. I'm just going to see if I can open this up a bit bigger. Now, this is where you've got to help me, everyone. We've got to write our introduction. So in order to write an introduction, we have to make the purpose really clear. So this is where it's your chance in the audience. Who'd like to begin? I'll put the first letter, I. Now, you've got this information. We should put the diagnosis or prognosis in the introduction, and also we need to say why we're writing. So I'm going to throw it out to the audience now. Who'd like to type in a possible introduction? And I'll check what you write, and I'll help you a little bit with that. So we want to put a bit of personal information. We're going to try. We might put her age in here. We might put a little bit about who she is, not too much. And we might briefly summarize some information about what happened in hospital, but not too much detail yet, because we'll put that in the next paragraph. So a quick summary of her condition and reason for writing. So I hope you're madly typing away now, and we'll see what you come up with. I'm looking for your chat in the box. I'm not getting the chat here at the moment. Let's see if I'm missing something here. Can everyone just type in a hi? Just make sure I can see that, because I'm not getting your chat coming up. Whoops, Daisy. Okay, thank you. Thank you. Good. I know that's working. All right. So I'm going to help you a little bit further while I'm waiting for this. I'm having a bit of fun with my technology, everyone. There we go. Thank you, Russell. Russell's got us going. Well done, Russell. Okay, let me just make this screen a bit smaller. Juggling with technology, multitasking. Okay, that should be quite clear on the screen. Okay, let's continue. Slightly out of alignment, but I think we've got the idea here. Just a little bit more work. Bear with me, everyone. First time I've had the screen set up the way I do now. Okay. Nice balance. Okay. So I am. And now Russell put, I'm respectfully referring this patient into our care. So respectfully referring this patient into the care, but or back to your care. Well, we don't need to, in formal communication, we don't really need to say respectfully. We need to just be direct is a better way to write. So I would say, I am, right? But I'm going to say it slightly differently. Now, Rush has written, I'm writing to refer. Now, that's reasonable, but I wouldn't call this a direct referral. I want to use a little bit different. I often see we could call it a kind of referral, but for me, referrals are a little bit where we are referring to some sort of consultant or another health professional, but because here we're actually requesting something rather than actually referring on a patient, we can be more specific, everyone. So we can actually write here, I am writing to request. So we can take our language from the introduction. I'm writing to request. Let's open this up a little bit. Palliative respite admission. Because now we're nice and direct. The reader knows immediately why we're writing this. So that's actually a nice touch. So just getting that precise introduction is a good thing. So I'm writing to request palliative respite admission, and then I can follow what other people have written. And look, Nesrine's got a good one. For this patient, I want to put her age. I know we've got date of birth, but that's just a number. So I reckon, I like to personally think it's nice to put an age to the patient. So we do the math. So we're in 2019 now. Can anyone tell me how old this patient is? A something year old woman who, did anyone work out the age if she was born in 1976 and we're now in 2019? Can we work out her age? "43, thank you, Gemma. Let's put that in there. She's 43. A 43-year-old woman who, now I can use some of the language that you guys have used, a 43-year-old woman. So we've got end-stage ovarian cancer. Yep, or stage 4 ovarian cancer. Diagnosed with stage 2. These are really good. Now I'm going to test your vocabulary, everyone. I want to test your vocabulary. Give me another word just to show your language. What's another word for end-stage ovarian or cancer, end-stage cancer? Can you think of any other words that summarize end-stage cancer? Let's check your vocabulary. And Jasprit said, the purpose of this letter is to refer Mrs. Ball back into your care, who's been, we've got to be careful, a few little grammar errors there. Thank you, Russia. Let's go for terminal. A 43-year-old woman who has recently been diagnosed with, let's move the screen, with terminal cancer. Now I could put stage 4 ovarian cancer. I'm just showing you a little bit of a different style, and I'm not putting all the details here because I want to put it in the introduction. So I'm going to write it like this just so that I can, just got to watch. It's slightly out of line, but I think you get the general idea. So there's our introduction, everyone. See how it's got a good purpose? I'm writing to request palliative respite admission for this patient, a 43-year-old woman who has recently been diagnosed with terminal cancer. So we've got quite a lot of information here. It's a nice start to our letter. So introduction is done. We put the address, we're away now. So now we have to go to our next slide, everyone. So let's continue, and now we're going to put in some detail. Abdi Ali says advanced cancer. That would be a great word as well. So you can use terminal or advanced. So just remember that, everyone. It's a really nice touch to be able to show off your vocabulary if you have it for those sorts of things. All right, now I'm just going to move this over a little bit just to help with the screen. I'm juggling with screens a little bit here today, so I want to make sure you can see okay. It's a bit of a juggle with my monitor, everyone, if you're wondering what I'm doing. Okay, so now we've got to write our next paragraph, everyone. So let's go to the next page. So we're going to write our body paragraph. We're going to talk about the past history, about the admission to hospital. So we're going to use mostly past tense. We're going to be careful to select the right information, and we're going to focus on the recent history, and we're going to omit non-relevant information. Okay, so first question, let me ask, what information can we omit from this page, everyone? You tell me. We've got a medical history, tonsillectomy, appendectomy, admission, laparoscopy, and we've got to be, what information can we omit from this page? That's my first question to you. I think you all know pretty quickly what information are we not going to include. Yep, thank you, Nesreen. We're not going to include tonsillectomy because that has nothing to do with her current health. And you're not, thank you, Aisha, we're not going to include appendectomy. So it's very important you don't put this information in because it has no bearing on her current health. It's a part of the medical history that is not relevant to the person you're writing to, the director of the Palliative Respite Admission Centre. It's not going to help them do their job, and it would actually distract them if you included it. Okay, but the rest of the information, I think it's quite important. You know, we might talk about the admission, you know, there's a lot of information here that we might include, but it's just getting rid of that first information, right? That's not relevant. So that's your job, to be able to select information. So now we're going to write it, everyone. So we're going to begin with, how are we going to begin, everyone? How are we going to begin this one? I'll tell you what we won't do. We won't say regarding her medical history because we're not actually going to talk about her past medical history. We're going to talk about her current situation. So I think we should begin really directly with what we see on the first line. I'll get you started, everyone. Mrs. Ball was admitted, all right, to, and we saw the place, yep, Spirit Hospital. We use a capital here. Spirit Hospital on, and we can put a date. What's the date here? On 18/12/18. All right, now we've got to keep going. So what else are we going to do here? I'm going to look a little bit about what you're writing. So feel free to put in your thoughts on sentences here, and I'll respond to that. But she was admitted to Spirit Hospital on this date. We could put the reason, due to severe stomach pain. We could shorten that and if we wished, but let's put it in. So it's not too different, but we've just expanded and written on full. So it's always a nice idea. You could use initially Allah as well. And if we did want to put initially, you could do this word here, initially, if you wanted to add it. And I've got to spell severe correctly there. Okay, I'm looking at some sentences you guys are writing. Whoops. Just lost that page. Let me just go back to my, oops, I've just lost my Facebook page. Wait a minute. Okay, a few different sentences coming in. And And then she underwent a laparoscopy, thank you. Because she was, yeah, a few different options coming in. I'm going to go back to my version here. And then I might say, I'll go down the next line. Make sure I get this right. Good question from Wong. Can we simply copy? Yes, because remember when you're not actually copying the notes, you're writing down relevant facts from the notes. And just remember this, if they were relevant at the time, if that's the way they were described, they're described accurately. It's your job to expand on the case notes. You will get an opportunity for original language though. So here we might say if we want to use different language, we could say something like, well, I still like perform. So I'm going to say a laparoscopy was performed. Not being too original yet, that'll come, was performed. And now what do we put in our introduction? We've said, we've already mentioned the diagnosis, so, and we could say, and revealed, just for a bit of variety, and revealed stage 4 ovarian cancer with metastasis. So I'm going to show you something here with metastasis to the liver and left lung. So this is where we've played, we've worked a little bit with the language here, because it said it has metastasized. So here we're saying it was performed and revealed stage 4 ovarian cancer with metastasis to the liver and left lung. Now, Dr. Mustafa is saying, I think it's irrelevant to write symptoms and procedures done. Well, I mean, everyone can make their own decisions on that, but I think it's useful to give a little bit of background, but not too much. But I do think if you're writing to a palliative centre, they need to know. They need to know. They're doctors and nurses and staff, so I think they need that history to help them continue the care. Okay, and notice how we've expanded to the liver and left lung. Zainab writes, he, or should be she was admitted. Okay, good. So a laparoscopy was performed in real stage 4 ovarian cancer with metastasis to the left lung and I like that, and a poor prognosis. So that's nice original language there. Thank you for that, Mohammed, because it's nice to show different ways to write things. Novi writes, she was admitted with severe abdominal pain and laparoscopy was performed and revealed. That's very nice the way you've written that, Novi. Which, the only thing you missed, which had already metastasized to her liver and left lung. So lots of great sentences coming in there. Joseph is picking up that the laparoscopy won't see the lung metastasis. Okay, but let's not go and rewrite that. We can say that this was simply found with another procedure, but I'm working off the case notes. Don't pin me on to anything too medical here. So then we've got a bit more information. So we've summarized all that. We might mention about the chemotherapy. So we could put, let's change our structure. Mrs. Ball was offered chemotherapy, full stop. However, she refused. She refused, and now we've got to use and return home to her family. Now, I just want to show you something there. We're not going to put the purpose of the chemotherapy because that's known. You know, it was offered to shrink the tumors, but everyone knows why, so we don't need to say it. So it says she was, well, thank you for that. She was offered chemotherapy. However, she refused and returned home to her family. So we know that, and that's where you've taken over the care. Okay, and we've noticed how we've used offered. We have to make it passive because language in the case notes removes those be verbs. So we have to input those verbs. Okay, so now that's the history, right? And now we have to talk about now. She's discharged home on this date, increasing pain, depressed, not eating well. So now we're talking about currently. So that's the end of the past tense, everyone. Now we're talking about the current situation. So we might say something like, currently, what's a good word for pain? Can anyone describe the pain? We've stopped using past tense now because we've spoken about the admission. So now we're going to talk about now. We're going to talk about now because she's discharged home and we've got current medication. So Mustafa says we could have used a semicolon. You could have. I try to avoid semicolons, but nothing wrong with them. I just prefer sharp full stops in a medical referral letter. Thank you, Jane. That's the word I was looking for, currently. But I'm going to say she is experiencing increased pain. She is experiencing increased pain and is not eating well. Now, we could add depression if we wanted to, or we could leave it like that. She's experienced increased pain and is not eating well. You don't have to put everything in there. So we've got that. Or instead of saying not eating well, I could say she's experienced increased pain and has a poor appetite. Probably that's better, isn't it? And has a poor appetite. And if I wanted to add and has a poor appetite, I'll just show you, just playing with language, along with depression. So you can see I'm manipulating my sentences here a little bit. Mohammed's written, unable to take by orally. Yeah, but that sounds to me, unable to take orally is more like your handover notes rather than your letter. Smith has written his prognosis was so poor. You don't want to say so poor because that's emphatic. Simply it was poor. All right. Now we've got to put a little bit about medication. She's taking Stematol, OxyContin, Panadol and Maxilin. Who'd like to help a little bit summarizing the medication here? I want to keep it pretty short. How can we summarize that in a short way? Does anyone have an idea how we're going to do our medication? So can we categorize it? OxyContin and Panadol, would that be analgesics? If we wanted to summarize it, how would we do it? We could say she has been prescribed So I agree, Novi, increased pain is not the reason why she's depressed, but we haven't stated that either. We've simply stated the fact. Therefore, necessary medications were prescribed. Her list of medication includes analgesics. Yeah, in terms of a medication, that's all good. So she has been prescribed analgesics. It's not really regularly. She has been prescribed analgesics to manage her pain and Stematol to now, tell me if this is right. I'm going to say it says anti-nausea to help improve appetite. Would that be correct? Because if she doesn't have nausea, then the appetite will improve. So there's different ways we can do that. All right, so now we're up to the current situation. So we're putting it in order of importance here, everyone. We've gone straight to the point, exactly what happened to her in hospital. Russell writes she has been given home medication for nausea and pain relief. That's excellent as well, Russell. Well done. So lots of different ways we can do it. And you have to make a decision with medication of how much detail is required by the reader. All right, now let's continue. I mentioned what about the Maxilon? So Stematol, and thank you for pointing that out, Joyal. Maxilon. Okay. All right, let's continue. Next page, everyone. And I'm looking at Smithers' sentence. Today she is experiencing increased pain, poor appetite, along with depression. Yep, she was commenced analgesics. Probably, she can't say she was commenced. She was commenced on analgesics in order to manage her pain. So commenced on, or analgesics were commenced. So we've got variety there. All right, let's move to the next page. So we've covered everything there. Lovely. Now we're going to have something difficult to do, everyone. Something difficult. We've still got another paragraph. I'm sure we've written over 100 words here. So we're going to go to a new page. So now we're going to talk about, we're going to use a lot of present tense again here. And we're going to do the second body paragraph and the conclusion. Now, Zainab says, therefore, Stematol, OxyContin, and Maxilon were prescribed for nausea, pain, and gastritis, respectively. Now, that's a good sentence, Zainab, but I do try to remove terms like respectively, like in order. Just can challenge the reader a little bit. It's a little bit emphatic, so, but it's a nice sentence, but I would avoid that one. Okay. So now we have a challenge, everyone. And I know from working with a lot of health professionals, you're very good at describing all the medical factors. But when it comes to the social history, quite often you're a little bit out of your comfort zone. This isn't part of your training, right? So now we've got to go into social history. So that can be a bit of an issue. So let's have a look, and first let's do a bit of a selection. Now we've got to paint a picture here, everyone. She is going to respite admission. We've got a plan down the bottom. It says recommend respite admission for Mrs. Ball so that Mr. Ball can have a break and resume work. So I've been getting care for a couple of months, but it's getting hard for Mr. Ball, isn't it? It's getting hard for Mr. Ball. And he's agreed to this admission. So you're helping his family a lot, and it's come to the point where he needs a break. Hopefully, Mrs. Ball will make a remarkable or miraculous recovery and come home. But at this stage, she's going into a palliative respite hospital. All right. So let's decide what we're going to include and what we're not going to include. So we might put a little bit of, we're going to put some social factors so they know, you know, considering its end stage and at this stage where we're at, and this family might be visiting her in hospital, we're going to put a little bit of information. So we might put, perhaps we might mention that she has 2 children. All right. We may not mention the age. That's optional. We'll talk about that in a moment. Husband, main caregiver, reduce work hours to care for Crystal. That seems relevant. Reports difficulty in caring for a dying partner. Yep. Under emotional and physical stress. Yes. Children misbehaving at times, difficult to manage. Are we going to include that, do you think? House untidy, dishes not washed, not washed. Look, I'm probably going to say, and if you let me know if you disagree, but I'm going to say we probably don't need to go into this level of detail about children being misbehaving, and I wouldn't describe the house. I'd also wouldn't, Mike feels isolated and sometimes angry. Well, I wouldn't mention angry, but I would consider mentioning the isolation. And no other family support available, that seems good. The neighbour, I just think that's a level of detail we don't really need. Mrs. Ball doesn't like people coming to see her. Yeah, maybe. But that seems to me like current. Maybe that will change when she's in hospital. So personally for me, and you might disagree with me, there's room for flexibility, but I probably wouldn't mention that. But I would mention the spiritual advice. Now I've ticked all of this, but that doesn't mean I'm going to mention it all. So the other skill that you can take out when you're looking at something like this is you can decide, you can look for great vocabulary. So main caregiver, that's a nice expression. We might choose to use that because he is. It's a fact he's the main caregiver. And we might say that, you know, we might find a few important sentences that we like here. We might say, I'm going to use this word isolated. We might mention spiritual advice. So we're going to select words from here. We might mention support. So we're going to select words and turn it into sentences, everyone. And I think he reports difficulty. So we might put that as well. So one of your jobs is to find the key facts and then to write about it. Okay, so let's begin, everyone. Let's begin this paragraph, this challenging paragraph. So again, we could begin with something like socially, or we could just be direct. And we could say something like, Mrs. Ball lives with her husband. And you could put in here the name, Mike, if we like, or we could say Mr. Ball. We might just say lives with her husband and has two. Now watch this little trick. Oh, you're going to help me here. Can anyone give me a synonym for children? Now they're 10 and 12. So let's have a synonym for 10 and 12, because we don't want to, it's better to use some synonyms here, especially with age. Can anyone give me a synonym for that? Thank you, Jane. Well done. So this is where your writing starts to shape up when you write like this. You're showing a bit of flexibility with language. Okay. Now, Smith's right, her husband prefers to reduce work hours. I don't know if he prefers to. I would simply say, Mr. Ball has reduced his work hours, right? He's reduced his work hours. They're not teenagers, Nezreen and Wong. They're not teenagers because they're still under 12. Teenager is 13 and above. So they're not teenagers, like 13, 14, so not yet. Offspring, Kemas, no, we can't use offspring. That sounds like that's a little bit too scientific. Maybe we use that for animals a little bit, but not for children. Has reduced work hours to care for his wife. However, so this is where we have to say it. However, what's going on here? He's got difficulties, right? He's isolated. So here I'm just going to show you a kind of, Mustafa writes his working hours was impacted. Yeah, but we don't really want to focus too much on him. We're just saying what he did, how and has reduced, it's been done, right, to care for his wife. I'll just fix up that typo. Okay, however, let's continue. However, and now I'm going to show you a little trick. I like emotional, so however, he is experiencing emotional, there's many ways we could do this, emotional stress. I don't want to use both, so I'm just going to cut one out. He is experiencing emotional stress and feels isolated at times. There we go. So we've just selected some facts and put them into a sentence. So that's planning, everyone. That's planning. Joseph's written juvenile children. Wouldn't really use the word juvenile. It's like, that's a legal term, and this is a medical. So we don't want to use legal language. And Carla's written kids, and that's informal. And we've also got toddlers, but then they would be about 2 years old or under. So having that good vocabulary to summarize ages is a good skill. So he feels isolated at times. All right. However, he's experiencing emotion and feels isolated time Now, anything else we're going to say? We've almost covered it, you know. We don't have to go into too much more detail. We've got the main idea. I wanted to give you one more sentence. What else? He's experienced emotional and physical and feel isolated at times. Okay. 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 I'm having a look. We've got minus. He feels overwhelmed emotionally and physically. Yes, but overwhelmed's not a bad word, Desreen, but a little bit strong. I would just go straight to, I'll just show you a type of sentence. Due to the difficulty of the current situation. Can you finish that sentence for me, everyone? Because it's nice to have an overall, if you want to go for A, you've got to bring in some original language here. So I know some of you are probably going for A. So due to the difficulty of the current situation is an overarching summary. We can look at all those problems and we realize that it's difficult. So can you finish that sentence for me? Due to the difficulty of the current situation, what are we going to write? Maybe have a look at your plan. Russell said, in spite of this circumstance, there's not a contrast here. I'll let you guys finish this sentence. Due to the difficulty of the current situation, so what's happened? What's the result? See if anyone can finish that. Look at the plan, everyone. Look at the plan. We're not using the spiritual advice yet. Because I'm not there. I know I can see why you're going for spiritual advice, but no, we're not talking about that. Look at your plan, everyone. Thank you, Joel. Mr. Ball has decided to admit, not her wife, his wife. Good. Due to the difficulty of the current situation, I'll use your words. Mr. Ball has, I'm going to borrow from what Russell wrote, has agreed to respite admission for his wife. So do try when you're writing this. When you do this, everyone, think about a forest and trees. When you look at a forest, it's made up of individual trees. And when you're paraphrasing, you're going to describe those trees. But when you want to talk about the overall situation, you're describing the forest. So do try when you write your medical referral letters to not only describe the trees, but don't forget to describe the forest, the overall situation. Okay. All right. And we could say Mr. and Mrs. Ball has agreed, but we're not quite sure about, this case says Mr. Ball, he has agreed. So I'm going to stick to Mr. Ball has agreed to respite admission for his wife. And we're done there, everyone. I might even just use one more sentence. Please note, Mrs. Ball has requested, this is optional to put this, but if you felt it useful, has requested spiritual advice. Or you could say it would be appreciated if you could provide spiritual advice for Mrs. Ball. That's another way to write it. And now we've only got one sentence, our conclusion, everyone. So all we have left to do is write our conclusion. So who has a suggestion for a conclusion? I like it to be polite. It would, and you can finish this sentence for me. It would be greatly appreciated. It would be greatly appreciated if you could. I'm going to show you a little trick here, everyone. What do you want the director to do, everyone? Oh, submitted about due to the difficulty of the current situation, Mr. Ball, not allowed, has agreed to, not so much allowed. Oh, I like that word, spiritual. I'm going to borrow from you, Kemsa. Well done. Let's go counselling. If you want to show off your vocabulary a little bit, always a good thing. It would be greatly appreciated if you could, what? Now I need a word there. It's a gap fill, everyone. What's happening here? You're requesting, admit Aisha is good, but I don't want to use admit. You're close though. I'm going to start with an A. Anyone know? Oh, I don't want to use admit. Admit's good though. Definitely could use admit. Something we do. Yes, well done, Mustafa and Janu. Accept. Accept, Mrs. Ball. There you go. Into your care. So we're showing a bit of original language. We're thinking about it. Not so much allow, into your care. And then you can say, and we're going to say the reason. We should say the reason. If you could accept Mr. Ball into your care, and we're almost going to use the same sentence, so that Mr. Ball can have a break and resume work. To accept Mrs. Ball into your care, and I might, to ease the pressures faced by this family. I've just decided to add that in, everyone. But you don't have to write like that. You could say, so that Mr. Ball can return to work. but I'm just trying to use slightly different language to ease the pressures faced by this family. That's one option. Or you could put so that Mr. Ball can have a break and return to work. Okay, and then you just end. That's it. Yours sincerely, and sign off. We've done it, everyone. We've done it. We've written our letter. We've written an introduction. We've written a paragraph talking about the past history, the initial admission. Then we put a lot of details about the social history. We've done it all live. There's some great ideas coming from the audience. I've tweaked it a little bit, but give yourselves a clap. Well done, everyone. Well done. Now, we've just got a couple more minutes, so I'm just looking at a couple more sentences. Smith has written, in view of the above circumstance, it would be profoundly beneficial. Now, we don't want to say profoundly beneficial because that's a little bit too emphatic. We don't need to emphasize things. Nezreen says, faithfully or sincerely. Look, I prefer sincerely as professional correspondence, but look, I see faithfully out there. It can be used as well. I'm a fan of sincerely though, but I think it's still acceptable. All right. Any questions, everyone? Any questions? I'll put your name at the bottom. But no name as no name. Just put your name. Yours sincerely, health professional. I've run out of space there, so I'll just put yours sincerely, XXX. There you go. Abdil's written, if you have any further queries, please don't hesitate to contact me. Yes, if you need, but I don't think it's necessary in this case. We've already stated enough, but you could add that. Steve, can they write currently instead of today? Yes, depending on the circumstance, you can. Does metastasis need any articles? No, you can't say aim. It's an uncountable noun. Wong, it's an uncountable noun. All right, excellent. So everyone, when's your exam date? When's your exam date? Who's got an exam coming up soon? Who's got an exam date coming up soon? We got May, we got different things. 16, so Wong's not far off. All right. Well, don't forget, if you feel you need some preparation, I mentioned this last time, I got these great new courses going. If you've only got a week to prepare, if you're exam and you haven't done a course yet, check out the standard course. Nice, lovely little course with virtual classes. It's pretty well priced, so that's a nice thing to consider. Economy, if you want a rapid review. And then we have a range of other courses. So as you know, we've got great stuff on our website at OET Online, so make sure you come and check it out. Got a great team of teachers ready to help you. And if you do happen to live in Brisbane or nearby, you can come to our group classes up here. So we're always happy to help. Make sure that you pass this exam. Allah says, any advice for reading part C? Be a deep reader is my advice. Don't read on the surface, read deeply to understand. But in coming sessions now, we've done a whole lot on writing, so we will be moving forward into other areas in coming sessions. Abdullah wants to see the introduction again. It's gone now, but watch the video, Abdullah. It's going to be coming up. Watch the video to review this again. Carla says, is there a standard language or standards healthcare industry on how to write? Yeah, well, I don't know if there's not one standard, but there are conventions of language you should follow, and lots of examples out there. But be careful, everyone on YouTube. There's lots of examples that aren't very good at all. So it's like any research you do. Be careful where you get the information from, because there's a lot of misinformation. So do get information from the experts, particularly the English language teachers who focus on OET, because then you know, and premium preparation providers, because we're endorsed by the OET Centre. So that's your guarantee of quality. So you need to consider that you could get the wrong information. So take care with that. All right, everyone, we're done. Thank you very much for coming today. Good luck in your exam, everyone, whenever it may be. And we'll see you for the next session. Bye for now.